Alright, so now that you've had a chance to watch the first video where you learned the common causes, 3 things you can do, and also things to be wary of, to stay away from, now I'm going to show you some of the best movements that really help to escalate and accelerate pain relief. So there's several different several different joints in the body that cause the most pain. Lower back, hips, knees, shoulders, neck, and obviously there's pain in the elbow and fingers and things like that. But today I want to focus on showing you the best movements that you can do at home. I'm here in my family room here, and it's very easy to do. You can do it anytime from the comfort of your own home, and you don't need to go to a gym or you don't need to go to a clinic or anything like that to do these movements. Now I know that if you do get physical therapy or chiropractics or acupuncture or any of those types of care, they're going to probably have you do some exercises and too, but this is very different. Joint specialists are experts in understanding joint pain, so it's probably going to be very different than what you might have been told before. I'm not saying those other things are bad, not at all. Movement is typically, out of pain ranges, in pain-free ranges, are typically always good, but we're going to show you more advanced movements, things that work a lot more quickly. So let's go and start with the back. So if you're having pain in the back, and most back pain is actually related to the joint as well. It's related to the discs and the joints, and the joint encompasses a complex set of structures, but this works super for most back pain, sciatic pain, those kind of things. So there's 3 different categories, and you have to know which category that you are at. So if you're not sure after I explain it, then you should call a physical therapist near you. Now at the bottom of this, you'll be able to contact a joint specialist provider that's part of our network. You can email them quickly or you can give them a call. But you should first know your category, because I'm going to show you a movement, but there's 3 variations of it based on your category. Now, just to make things simple for you, there's category 1, which is mild. Your joint pain and problem is not that bad. Then there's medium, and then there's a lot. Now this means your joint pain and problem is very complicated, it's very complex, so you're going to have to take extra precaution when doing this movement. But once again, if you have any pain at all, make sure that you don't do this if it aggravates the pain. So let me go and show you first. First of all, this one is going to be very important for you. What you can do, now this is for somebody who is, let's start with the severe. So if you're having a lot of pain problems and you have a complex joint situation, then what you're going to do, all you're going to do is start with bending your left knee, and as long as that's not painful, doesn't elevate your pain too high. Too high is like 2 points or so on a 10-point scale. But if it doesn't elevate too high, then what you want to do next is you just want to step back like this, keeping everything still, just moving at the hip. You're going to just step back like this. And you're going to touch your toe and come back. Now, I want you to do it comfortably and keep your balance. Now, if you do have some balance issues, then I do want you to use like a stool or a cane or something like that, or a counter. I'm just going to use a stool here. But you're going to just step back like that. Now, you want to do this, you're actually going to do this 100 times. You can take breaks, yes, if you need to, because of that, you're just going to realize that you're going to start getting a little bit tired in some of the muscles in your buttock, your quadriceps, your legs. So if you need to take a break, if it starts burning too much, go and stop and take a break. But this is for somebody who has severe, complex joint problems. So you can do this with a little bit. Now, don't push into pain. Don't force it through pain. I just want you to contract certain muscles. And we're actually we're doing more than strengthening here. We're actually facilitating some nerve movements as well. Now as you're doing this, and you can follow along with me, and even me right now as I'm doing this, I've done it about 30 times and I'm feeling I need to take a break. I'm a little out of shape myself, but this is a really great movement. Make sure to keep that knee bent. Now what this is doing is it's working the glute muscles, which is so very important for back problems. But it's also working the glute muscles on the other side. But it's also working the hamstrings. But at the same time, which is also very important for back pain, is it's actually neurophysiologically, it's stretching this front part of your hip muscles, which is also very important. It's also engaging your back muscles, the erector spinae, but it's also engaging the core muscles, because what I want you to do is I want you to pull your belly button into your spine. Don't hold your breath. Warning, do not hold your breath, but pull your belly button in and do those things as you are stepping back. Now I need to take a break. Now that was pretty tough. I can feel it a lot on this side, and that's the whole point. We're working, this is called multifunctional movement. We're working multi-centers, multi-regions, multi-systems of the body to get the greatest effect with the least amount of time and effort. So I took a break, that was about 50. Whew. So now I'm gonna go and I wanna finish out the whole 100. Now, if it's too much for you on your first few days, then stop at 50. Don't force it, don't push it. I don't want you to get too sore where you feel like you can't do it the next day. And there's a delayed onset soreness. You may not get that sore that day that you do it, but the next day you're gonna feel it. So that's why I don't want you to push it. I only want you to go 60% into what you think you're capable of doing your first 3 days. And you only need to do this once per day, not a whole lot. So if I were to go and do that again, I would do it this way. Now, challenge yourself if you don't have any balance issues or disorders, and you're a little bit more athletic. Challenge yourself. Put your hands on your hips and just step back like that. Make sure to keep the knees bent, belly button in, always breathing in through your nose, out through your mouth slowly. And you want to do this 50 times. Now this is for somebody who has severe complex joint problems in the back. But we're working a lot of different things at once. Now if you are medium, what I want you to do is actually don't want you to touch your toes. Actually what I want you to, now you don't have to hold this, I'm not going to use this anymore. So if it's medium, then I'm going to have you, instead of doing this, I'm going to have you kick. We call this donkey kicks. This is DK1. Belly button in, and you're just going to kick back. Now this is going to be much more challenging because you're balancing on that one leg, and you're going to get a lot more work to it. But once again, this isn't just strengthening. This is also neurophysiologically affecting and strengthening the nerves, but we're working the glutes, the hamstrings, the erector spinae, the core, at the same time stretching the anterior hip muscles, the front hip muscles, multifunctional movement. Now obviously there's more progressions to this, but let's stay basic for now. See, I'm already getting out of breath. This is how out of shape I am, but my back is actually really good. I don't have that much back pain. So now if you are mild, you don't have a whole lot of back pain, and your joint problem isn't that complex, it's just mild, then what you're going to do is the same thing, except you're actually going to kick into a pad. So someone's going to be holding a pad, or if you have a punching bag, or even a tree outside in your front yard, you can gently kick into that and progressively get a little bit more intense, put a little bit more force into it. But that is really amazing when you can actually kick into and actually hit a pad. Once again, we call these donkey kicks. DK, this is DK2. and you're kicking into a pad, you really start to work all the different structures and the complex systems that really bring health, strength, power, stability back into your core, which will really start to accelerate the pain relief in your lower back. So that's one for the lower back. We'll be making more videos for the hip, the knee, the neck and shoulders in the future. So look forward to seeing you again. Bye.